Hello everyone, myself Dr. Ranjana Gogoi, Associate Professor of Statistics working at Gurgaon College. Today's presentation is on Introduction to Demography and Vital Statistics. And this topic is taken from BSc 6th semester non-CBCS Statistics Major Course, STSM 602 Applied Statistics, Unit 4 under Demography University. In this presentation, I shall try to explain what is demography, how vital statistics data are collected, what is the government mechanism to collect vital statistics data in India, and so on. So, what is demography? In short, demography is the scientific study of human population. All of you know that in statistics, population means aggregate of objects, animate or inanimate, under study. But in demography, the population is always a human population. So what is demography? The study of statistics of human populations, their structure and changes, and the factors responsible for the dynamics such as birth, death, income, or the incidence of disease, marriage, divorce, migration, etc., which illustrate the changing structure of a human population is called demography. Most of the statisticians define demography as the whole study of mankind as affected by heredity or environment, insofar as the results of this study can be arithmetically stated. The term demography was first used by a Belgian statistician, Achille Gillard, in his 1855 publication, Elements de Statistique Humaine, Your Demography Compare. But John Grun's natural and political observations mentioned in a following index and made upon the bills of mortality published in 1662 in London is generally acknowledged as the first published study in the field of demography. Now, what is the meaning of vital statistics? Vital statistics means the vital events or vital records. They are important source of demographic data. That means the record of birth, record of death, record of marriage, etc. These are known as vital events. So they explain statistically such events as birth, death, marriage, divorce, etc. Many more events are there also, such as migration, in-migration, immigration, emigration, etc. Vital statistics provide cumulative summaries for consecutive time periods of population movements like birth, date, migration, marriage, and marital dissolution, as well as demographic and other relevant characteristics of the individuals involved in these events. Normally, in underdeveloped countries, due to mass illiteracy and ignorance, the registration of birth, date, marriages, etc. is not done, especially by the people living in rural areas. It is due to their illiteracy and ignorance about the registration of all these events. But in majority of developing countries and in all developed countries, registration of vital events like birth, date, marriages, divorces, migrations, etc. is a compulsory process. So, Vital statistics actually forms perhaps the most important branch of statistics as it deals with mankind in the aggregate. So it is the science of numbers applied to the life history of communities and nations. So now what are the uses of vital statistics, the importance of vital statistics? There are so many importance and uses of vital statistics data are there. A birth certificate. For an individual, a birth certificate issued by the registering authority is an important document which records the date, that is the date of birth, time of birth, place of birth, and parentage, the name of the parents to the person. It establishes his identity as a citizen of the country. So this birth certificate is a legal document which is used for admission to a school, for getting a passport to travel abroad, and even to migrate to another country. Similarly, a marriage certificate records the marital status of a couple and legalizes the birth of children from that marriage. From legal point of view, certificates relating to birth, date, marriage, divorce, etc. have legal importance. And for example, a death certificate is an important legal document for the settlement of property of the deceased person, the claim of his or her insurance policy, etc. For health and family planning program, vital statistics is used. Vital statistics relating to birth and date are used in health and family planning program by the government. The causes of death and the mortality rates of different categories help in assessing the health condition of the people. The state can also formulate health programs, different health programs such as malaria eradication program, polio and smallpox immunization program, tuberculosis, etc. with the help of the vital statistics. To study the social conditions of a society, these vital statistics that are used, birth and death rates, divorce rate, widow remarriage, widowhood, etc. throw light on the social conditions of a society. Also, its customs and traditions. And for administrative purpose, data relating to growth of population in the various age groups help administrators to plan and formulate policies for public health, education, housing, food supply, etc. So everywhere, vital statistics have a numerous uses. The rules for immigration and emigration are framed on the basis of population growth data. It is also used for updating electoral rules and demarcation of constituencies. Some important definitions. So vital events means the events of human life. Vital events are the events of human life as birth, death, sickness, marriage, divorce, adoption, etc. Population. I have already defined population. By population, the totality of all human beings living at a certain point of time within a territory demarcated by geographical, political, or cultural boundaries is called the population. The population is the totality of all human beings, not any other objects, living at a certain point of time within a certain boundary is known as population. Then cohort. Cohort means all persons born during a given year is called cohort or birth cohort of that particular year. A population is thus the aggregate of the survivors of cohorts of different years. Next, the rate of vital events. The rate of vital events is the ratio of the total number of occurrences of a particular event to the total number of persons exposed to the risks of occurrences of that event. This is the ratio of the total number of occurrences. Suppose date, ratio of the total number of dates to the total number of persons exposed to the risk of occurrence of that event. That means total number of persons exposed to the risk of date. Now, what are the different sources of demographic data in India? There are many important sources of vital statistics data in India. Number one is the population census. This population census in India is done in every 10 years. Then civil registration system, demographic sample survey by National Sample Survey Organization, sample registration system, and there are number of health surveys, National Family Health Surveys, district level household survey, then annual health survey, and so on. So what is civil registration system? Civil registration system records number of vital events. So in India, vital records obtained under civil registration system have got administrative uses in designing and implementing public health program and carrying out social demography and historical research. The Office of the Registrar General of India was created in 1951 and the Vital Statistics Department was transferred to this office from the Director of Health Services in 1960. On the deliberation and recommendation of various committees, the Registration of Birth and Death Act 1969 was enacted by Parliament to enforce uniform civil registration throughout the country. Then, National Sample Survey Organization, NSSO, data on fertility and mortality from the census are not very reliable and they are also available only once in 10 years. Since our population census is done in every 10 years, so we do not get the data for fertility and mortality for each year. So, in the absence of reliable data from the civil registration system, in the civil registration system also, we do not get the whole data. So, the need for reliable vital statistics at national and state level is being met through the sample surveys launched from time to time. And this is done by National Sample Survey Organization. So, NSSO attempted to provide reliable estimates of birth and death rates for its regular rounds. Next, Sample Registration System SRS. The Government of India in the late 60s initiated the Sample Registration System. In the Sample Registration System, there is a continuous enumeration of birth and death in a sample of villages or urban blocks by a resident part-time enumerator. And then an independent 6-monthly retrospective survey by a full-time supervisor is carried out. The data obtained through these two sources are matched. The unmatched and partially matched events are re-verified in the field to get the correct number of events. The data are verified and re-verified by a field survey. At present, the sample registration system provides reliable annual data on fertility and mortality at the state and national levels for rural and urban area separately. Survey for rural area and urban area are done separately because the questionnaire for rural areas and urban areas are different. because the parameters responsible for the various vital events are different in rural areas and as well as in urban areas. In this survey, the sample units, villages in rural areas and urban blocks in urban areas are replaced once in every 10 years. In every 10 years, sample units, that is the villages in rural areas and urban blocks in urban areas, are replaced in every 10 years. 3 health surveys: National Family Health Surveys, district level household surveys, and annual health surveys. The National Family Health Surveys and the district level household surveys conducted for the evaluation of reproductive and child health program. 5 rounds of National Family Health Surveys have been completed till 2020. These rounds are of 2 years of duration, and till 2020, 5 rounds have already completed. These provide estimates of fertility, child mortality, and a number of health parameters relating to infants and children at state level. They also provide information on the availability of health and family planning services to pregnant mothers and other women in reproductive ages. The district level household surveys provide information at the district level on a number of indicators relating to child health, reproductive health problems, and the quality of services available to them. 4 rounds of district level household surveys have been completed so far, and in each of the rounds, the survey was conducted in 2 phases spread over 2 years. But annual health surveys are done annually, and there are special health surveys conducted for empowered action group states. There are 8 empowered action group states are there. They are marked as least developed states. They are Bihar, Chhattisgarh, Jharkhand, Madhya Pradesh, Orissa, Rajasthan, Uttaranchal, Uttar Pradesh, and Assam. So the concept of annual health survey was arised by National Commission of Population in 2005 and was decided to carry out annual health survey of all districts, which could be published, monitored, and compared against benchmark. The Ministry of Health and Family Welfare initiated follow-up action for implementation of this decision, and this surveys is conducted through the Registrar General of India, Ministry of Home Affairs. The survey has since been launched in April 2010. So, through this presentation on demography and vital statistics, it is tried to highlight about what is demography and vital statistics, how different vital statistics data are collected in India, the mechanism of government of India by which various vital statistics data are registered in a compulsory manner, and so on. So, I conclude today's presentation here. Thank you.